Oleander is an evergreen shrub commonly found in warm climate regions. Despite its toxicity, it has been the subject of study due to the possible medicinal benefits that could be derived from its active compounds. Next, we will explore some medicinal properties associated with oleander. Cardiovascular activity. Oleander has been investigated for its possible cardiotonic activity, that is, its ability to strengthen and regulate the function of the heart. Some animal studies have suggested that certain compounds present in oleander may have positive effects on cardiovascular function, such as improving blood circulation and reducing blood pressure. However, more research is needed to confirm these findings and determine the safety and effectiveness of oleander in the human context. Anti-tumor properties. Some studies have investigated the possible anti-tumor effects of oleander. It has been shown that certain plant compounds can inhibit the growth of cancer cells in vitro studies and in animal models. However, the toxicity of oleander limits its potential use in cancer treatment, and more research is needed to evaluate its effectiveness and safety. Anti-inflammatory properties. Research has been done on the possible anti-inflammatory effects of oleander. It has been shown that certain compounds present in the plant may have inflammation-reducing properties in animal studies. These findings suggest that oleander could have therapeutic applications in the treatment of inflammatory conditions, although more research is required to fully understand its mechanism of action and evaluate its safety and effectiveness in humans. Antiviral properties. Some studies have investigated the possible antiviral effects of oleander. It has been shown that certain compounds present in the plant can inhibit the replication of certain viruses in vitro studies. However, more research is still needed to better understand this effect and determine its clinical applicability. Analgesic properties. The analgesic potential of oleander has been investigated. Some animal studies have shown that certain extracts of the plant can have analgesic effects, helping to relieve pain. However, more research is required to determine the exact mechanisms involved and evaluate the safety and effectiveness of oleander as a pain reliever in humans. Antispasmodic properties. Oleander has traditionally been used in herbal medicine to relieve muscle spasms and calm cramps. However, due to its toxicity, it is not recommended for internal use for this purpose without the supervision of a health professional. Antimicrobial properties. Certain compounds present in oleander have been shown to have antimicrobial activity, meaning they can help fight pathogenic bacteria and fungi. These findings suggest possible use in the treatment of skin infections and diseases caused by microorganisms, although more research is needed to confirm its effectiveness and safety. Antiparasitic properties. Oleander has also been studied for its possible antiparasitic effects. Some studies have found that certain compounds present in the plant can help fight intestinal parasites. However, as with other aspects, more research is required to support these findings and determine their clinical applicability. Cardiotonic properties. Although oleander is toxic for human consumption, certain medications based on compounds extracted from the plant have been used in traditional medicine to treat cardiac conditions, such as congestive heart failure. These medications are administered under strict medical supervision and in controlled doses to avoid adverse effects. Expectorant properties. In some cultures, oleander has been used as an expectorant to help relieve congestion and facilitate the removal of phlegm in the lungs. However, its use for this purpose is not recommended due to its toxicity and the availability of safer and more effective alternatives. Emmenagogue properties. Oleander has been used in traditional medicine to stimulate menstruation and relieve symptoms associated with irregular menstrual cycle. However, due to its toxicity, its internal use is not recommended without the supervision of a health professional. Antispasmodic properties. Some research suggests that oleander may have antispasmodic properties that help reduce muscle spasms and calm the nervous system. However, due to its toxicity, caution should be exercised and its use avoided without the supervision and guidance of a health professional. Pro-immunomodulatory entities. Preliminary studies have been conducted indicating that certain compounds present in oleander may have effects on the immune system. These compounds could have the ability to modulate the immune response, meaning they could be useful in the treatment of autoimmune diseases. However, more research is needed to confirm these findings and determine its effectiveness and safety. Antiviral properties. The antiviral potential of oleander has been investigated due to its content of active compounds. In vitro studies have shown that extracts of the plant may have activity against certain viruses, including the herpes virus and the influenza virus. However, more research is required to evaluate its effectiveness and safety in clinical trials. Healing properties. In some medicinal traditions, oleander has been used topically to accelerate the healing of wounds and burns. It is believed that its active compounds can help promote tissue regeneration and collagen formation. However, due to its toxicity, it is important to exercise caution when applying it to the skin and seek appropriate medical guidance. Antiparasitic properties. Some studies suggest that certain oleander compounds may have antiparasitic activity, especially against certain intestinal parasites. However, the plant's toxicity limits its potential use in this field and more research is needed to evaluate its efficacy and safety. Anti-inflammatory properties. Oleander has been the subject of studies for its possible anti-inflammatory activity. It has been shown that certain plant compounds can inhibit the production of inflammatory substances in the body, which could have benefits in the treatment of inflammatory diseases such as arthritis. However, the toxicity of oleander necessitates a cautious approach and further research in this field. Analgesic properties. It has been observed that certain components of oleander may have analgesic effects in animal studies. These compounds could help relieve pain, although more research is required to better understand their mechanism of action and safety in humans. Antifungal properties. Oleander has shown antifungal activity in preliminary studies, meaning it may help fight fungal infections. Some plant compounds have shown the ability to inhibit the growth of certain pathogenic fungi. However, more research is needed to confirm these effects and determine the safety and effectiveness of oleander in treating fungal infections in humans. Antioxidant properties. Oleander contains antioxidant compounds that may help protect the body against oxidative stress caused by free radicals. Free radicals are unstable molecules that can damage cells and contribute to aging and various diseases. The antioxidants present in oleander can help neutralize these free radicals and promote overall health. Antidiabetic properties. Some research suggests that certain compounds in oleander may have beneficial effects on blood glucose control. It has been observed that extracts of the plant can reduce blood sugar levels and improve insulin sensitivity in animal studies. However, more research is required to better understand these effects and their application in the treatment of diabetes in humans. Neuroprotective properties. It has been suggested that certain components of oleander may have neuroprotective properties, meaning that they may protect the nervous system against damage and deterioration. These compounds could have potential applications in the prevention and treatment of neurodegenerative diseases such as Alzheimer's and Parkinson's. However, more studies are needed to confirm these effects and evaluate their safety and effectiveness. It is important to note that oleander is a highly toxic plant and its medicinal use must be supervised by health professionals with adequate knowledge. Oleander should never be consumed or used without the guidance and consent of an expert in the field. Disclaimer: the information contained in this ebook is for educational and outreach purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult a healthcare professional before using any medicinal plant or natural remedy. The use of medicinal plants may have adverse effects or interact with medications or other health conditions. The author and editor do not assume any responsibility for the improper use of the information presented in this ebook.
Muchas gracias por ver este video. Si te ha gustado, no olvides darle a me gusta, comentar y compartir. Si quieres colaborar para seguir disfrutando de este contenido, puedes donar en el enlace de la descripción.